just have some meeting reminders. And then at the end, if we have time, we'd like to review and get some input on implementation project, specifically looking at the application for provider incentives. So I'm going to turn it over to Natalie that is going to review the REDCap resource survey.
Does everyone want to go and introduce themselves while I'm opening that up?
Great idea. Lori, you want to go first?
I'd love to. Good morning, everybody. My name is Lori Lanter. I am with the Unified Government Public Health Department and Child Care Licensing and co-chair on this working group with Rhonda. I'm going to pass that on to Erin so she can double up with me.
Good morning. I'm Erin Gaster. I'm with the Unified Government and Child Care Licensing as well. I'm going to pass it on to Chelsea.
You're on mute, Chelsea. Still.
I think it says she's off mute, but
She's going to type it. There's Chelsea Blakemore. She's with Platte County Health Department. She's fantastic. And she does, I can't remember. She's going to type the exact title, but she works with child care providers and providing support and consultation to them through Platte County Health Department. And she's going to pass it off to Sandy. Go, Sandy.
hi, I'm Sandy. I am the dietitian at the Johnson County WIC office in Olathe from Johnson County Health Department. And I'm going to pass it to Madeline.
Morning, everyone. My name is Madeline or Maddie. I'm a child care health consultant in the Northeast region for Child Care Aware of Kansas, and I office out of Kansas City, Kansas. I'll pass it on to Chris.
Good morning. I'm Chris Nicholson. I'm the Early Care and Education Initiatives Program Manager with Child Care Aware of Kansas. And I'll pass it on to Shelley.
Good morning. I'm Shelley Summer. I am the program manager for the Kansas City Healthy Lifestyles Collaborative and love supporting all of this work. I think this is a great group to be a part of. And I will, let's see, Lori, I'll pass it on to Lori.
Sorry about that. Good morning. Lori Wellner with the K-State Research and Extension Office in Wyandotte County. And who's left? Maybe hand it back to Natalie.
Sure. Did everyone go? Okay. And I'm Natalie Updike. I work for the Kansas City Healthy Lifestyles Collaborative and support this sector of the Kansas City Physical Activity Plan. In the chat, you will see a link to the REDCap survey so that everyone can see a demo of what we have so far. I wanted some feedback from you guys before I continue. Some of the labor intensive of creating each question for each of the resources before I continue. Since our last meeting, is it easy if I share my screen, or are you all looking at, let me see. I added the pictures of our logo and then that opening paragraph. If you guys have any comments on how to reword that, I'm open to that.
Do you mind
Um,
zooming in a little bit to make it easier to read? That's great. Thank you.
Basically just introducing who we were because I didn't know if people would know, and then explain the incentive for completing the survey. If that's what we've decided on doing for sure as well. I can't remember if we fully committed to the active books or some sort of other incentive like a gift card.
Natalie, just reading the first part, because we're going to be sending, our audience are those that may not know anything about the KCPA plan, correct? If we could elaborate and maybe add a paragraph
Okay,
after the first sentence, just high level, what the KCPA plan is,
that's a great idea.
and what we do. The early childhood sector doesn't have to be lengthy by any means, but just reading it and not knowing a lot, I would maybe be a little lost.
Okay, that makes sense.
Can you hear me?
Yes.
Yes. Okay. Something else that I was thinking is maybe what we're going to use this survey for, per se. Again, don't have to go into detail, maybe like one sentence. Sometimes I like to know what the survey's for when I fill those out. So
Okay. At the end, we haven't got that far, but when you submit, I do have like, we plan after we review these surveys to make them available to the providers on our website with a link to the website, but I can put that at the beginning too. Some information on what we're doing this for.
yeah, I feel like as long as it's in there, it's fine. But Rhonda says she would like it at the beginning. So
Great.
Yeah, I like that point, Chelsea, of knowing the purpose before I start the survey.
Okay. Is there any other feedback on that beginning section before I move on?
Just as a grammar thing, would it be who, on the second paragraph, those who complete rather than those that complete? I don't know.
Add that.
I have another thing. I don't know. So early childhood education providers, does that need to be spelled out? I mean, it should be self-explanatory for everyone, correct?
In that opening sentence.
I
I was
just,
thinking the same thing.
I mean,
Okay.
I'm sure it
Yeah.
would be self-explanatory, but
And so should it be early care and education providers, or should it be early childhood educators, or what's the most appropriate term?
Chris, are we still using early care and education providers? That's still the lingo?
Oh, Rhonda, it's all over the place.
Rhonda, we can't hear you right now for some reason.
Oh.
But it doesn't look like you're on mute.
Can you hear me?
I can hear you, Rhonda. Can you hear me?
Okay. Yep, I can hear you.
Okay. It's kind of all over the place. I think we could use the language that it is, but then I wonder, I think where some people get hung up is childcare center staff do not always refer to themselves as providers. But we could also, just elevate it and use the early care and education professionals. Something a term that we want to have people identify themselves as.
That's good input.
Could you repeat that, Chris, which term you prefer?
What I suggested was early care and education professionals.
Instead of providers.
Okay,
Great feedback.
okay, I'm just gonna go through this with some data to show how it works, and like, we'll link to the next question based on what you say. So we're gonna have everyone put their name and then ask if they even want this box set before we send everyone one. Maybe they already have it or something. If you click yes, then it opens up for your street address, state, zip code. And then if you prefer the Spanish or English version. I looked it up and they're the same cost for both of them. This next question is
Wait, I have a quick question about
Yeah.
that first section. So, and this group here can answer this better than I can. For the part about Dr. Kraft's resources, would it be helpful to provide a link, or is everybody going to know exactly what that is already?
I did a training the other day and I mentioned Dr. Kraft, and the education or the childcare providers did not know who that was. So I kind of like that idea, Shelley.
Yeah, put a link, whether it's in that question. I don't know how easy it is to put it in the question, or we put it in the paragraph above if it's easier to include a link there. And that way people can look at it or not look at it. Doesn't really matter.
Okay, I'll put a note. I don't know which one will be easier. I'll have to play around
Yeah.
with it, but I'll add it to one of them.
Yeah. And because we have their name required, do you think anyone's going to care? Because that now makes it's no longer anonymous. Now, we're not asking sensitive questions or anything, but do you think anybody is going to balk at the idea of having to put their name in here?
We discussed this at our last meeting, Shelley, and it was
Okay.
unanimous that no one thought they would care.
Okay, good. All right. Sorry.
Yeah, it's fine.
That's what happens when you go on vacation.
This next section is the list of all of them, and if they're familiar with which ones. For this purpose, I have to click one because I made some options for when you click one.
Are these active links, or we're just hoping that they know these titles?
Okay, I just got a response back from someone with REDCap experience at the hospital, and I think they're gonna help me. Either there's some coding that has to be done to insert a picture, so
Okay,
I'm gonna work on doing that.
okay,
Either
awesome.
that or a link to like a full resource page where they can link out and look at them.
Okay.
I don't
awesome.
know that, I think the picture would be helpful, but I don't think we want the full link to be out there if we're asking if they're familiar with it or not. I mean, if once they link to it and they're like, now I've seen it, now I'm familiar with it. So I think the actual information we want to know is starting out their baseline. What do they know about? And like I said, a picture might be helpful to like, oh yeah, I've seen that. I'm a little bit familiar with it. But I think if we put the link in there, then we're going to taint the data that we're wanting.
And I would add on to that too. Are we wanting to know if they're familiar? Or are we wanting to know, do they use it?
That's a secondary question down here.
Okay.
And then based on our meeting last week, you had suggested we add this question about which ones they share with families are useful to share with families. So I added that one in. And then a question if there's any on there that they use that maybe we forgot about.
I have a question or a comment.
Yeah.
So in the family section,
Mhm.
the way that the question is written, and I could be way off target here, but if I would read this as an early childhood professional, and let's say I was a center director, I would never send any of these to parents, but I might pull something from there and send to parents. Does that matter? I don't know. I mean,
I
I would
think it-
never send the whole Sesame Street workshop link to a family.
I think it does matter for the wording because based on what you're saying, somebody could say, no, we don't do it because we don't send that whole link. And that's really not and to me, that's not the intent. The intent is this a resource? Do you find anything here in whatever link it is that you would share with families? And so I agree with what you're saying, Rhonda. We may need to reword that in some way that helps the providers know what we're trying to get at. So we're not talking about that specific link, but we are talking about what you're alluding to, which is any resource. Do they pull stuff from this link to share with families? So maybe we say, select all of the following resources that you have pulled from to share information with families. Would that be more clear?
Or utilized information from,
Yeah. Any other suggestions for wording that?
Which of the following resources have you? Yeah, I don't know.
maybe shared information from,
Mm-hmm. I like that. Have you shared information with families from any
you
of
just
these
kind of put
resources?
about the same kind of language in the chat.
Nice.
I have to type it out and then I'm like thinking, so.
Is there a preference on those last two suggestions on which of the following resources have you shared information from with families? And have you shared information with families from any of these resources?
I really like the way Chelsea's is worded, seeing it in print. I may have the same opinion about the variation of Chris's if I saw it in print, but
The only discrepancy that I have is have you shared information as a yes or no? And which gives choice. But either of them I think would be beneficial.
thanks, Natalie.
Mhm.
I agree with Rhonda on the have you, which debacle. That's what it's called.
Okay. That's what we'll do then. On this question, I have the mouse on. Can everyone see that? Should I be typing that out again there? The ECE?
You could, but also you could change this to which additional resources have you include, or have you have you used, or something like that, instead of do you, which is a yes or no.
Agree with you, Sandra. Or please list any additional physical activity promoting resources that were not included in the above list that you use.
And I don't think we even need to have the ECE portion of it again, because if they have a really good physical activity resource that they use and share with families that isn't specific to early childhood,
Mhm.
who cares? As long as they're using it, we want to know what's
Yeah.
helping providers. So
Good
I
point.
would support dropping that out altogether. They may already be in the early childhood mindset and do that automatically, but I don't want to limit it to something that we may miss out on because we have such a focus.
Okay. Okay, this next section, I've got like 3 different options of how we could do the question based on if they've selected it as a resource that they use. So, actually. So, this is like one option here. I have to go through and individually make a question for each of those check boxes for this. So I just wanted to make sure which route you wanted to go before I went and did that for 25 resources. So this is one like view of it. This one's very similar right above it. It's just in a different layout. And then this one up here is a matrix where you put the name of the resource and then ask for separate questions about it. That would alleviate me doing 4 separate questions for 25 resources, but I understand that it might not be that clear what I mean by these scales. So I wanted to show you.
So I guess the question that I have is, what are we, this is probably a redundant question, but when I read these 4 questions that we have here, what are we wanting to get from this survey? I thought we wanted to get what resources are used the most. So are we wanting to know how useful it is, how easy it is, how often? I'm just wondering if those questions are what we want.
Some of these questions were discussed in our last meeting, but that's why I added them, but we can adjust them based on what the use of the survey should be.
So my question, I know you had said, depending on what you select as what your options are these options for everyone, even if they didn't say that they knew any of those?
These
Or
only
they only pop up if,
Mhm.
okay, they only pop up if they said that they do
use this
them.
resource.
Okay, I like that. And I don't dislike using the second option there where it has the 1 through 4 in a very straightforward, easy way, especially if that's less work and we're getting the same information.
Sometimes for me personally, when I'm filling out surveys, the first section, like the one that the first like 1 through 4 that you're showing,
Mhm.
sometimes I look at that and I'm like, oh God, that looks awful. I'm like, I have to read through that. So I kind of agree with Lori of the how useful is the CDC, and then like I don't know, the
I like
second
that too.
option, I guess. That makes sense.
I vote yes for that one too.
You like it written out like this.
I guess on the back side though, as when it reports out, is it easier to read and disseminate that information as it is those other ones, or does it really not matter because you're still getting the answers you want? I mean, the answers to the questions you want. Is it gonna, I guess my question is, when you are looking at the data and when we're evaluating that, is it then gonna be more difficult based on the way we formatted that answer? Where if we format it that way to start with, is it easier to gather that information? Is that, I don't know if that makes any sense at all.
Yeah, since I haven't really gotten into looking at responses from these, I don't know if I know yet which will be easier, but I think as long as we're like consistent across each resource, it should be okay. I guess I agree that it's easier to look at just one question with one response like this, especially since like the scale is a little different for each of these questions. I guess I would just request that we kind of like narrow how many questions we ask about each resource and make sure that it really has a purpose that we're looking at.
Well, one of the things I think about, and this is going back to, I think it was Rhonda's question about what's the purpose of asking these questions and what are we going to do with the information? There are a couple of things that may not provide us any additional information beyond them selecting the resource as something they use. And you all as a group are going to be able to answer this better than I can. But for the example of first question, how useful is this resource on a scale of 1 to 4? My assumption is if they're using it, it's useful. So does this provide us any additional information that would be helpful? That's one question. The other, can we say the same thing about how easy it is? I don't think we need 2 questions about how easy it is to use or access the resource. It should, if we're going to ask that, maybe it should be the same question. How easy is it to access and use this resource?
Bye, Chris. Thanks. Thank you, Shelley, for explaining that. Yeah, I absolutely agree. I think out of those 4 questions, maybe 3, number 3.
That might be useful.
Yeah, otherwise, I think the other questions maybe are not going to produce any additional information for us.
Right. I do like that this, and I think Natalie, you said this already, but so correct me if I'm wrong. I think you said that these would be, there's logic that's tied to this particular question. It would only come up if you selected that resource as one you used.
Yeah.
Yeah. So
Is
then
it, sorry, Shelley, is it coming from if you use it or if you are familiar with it? Because I thought the question before was if you were familiar with it, which is totally different than if you use it.
I currently have it linked to if you use it.
Okay.
What
Do
about
you-
adding? Oh, go ahead.
I was just going to say, do you think it makes more sense with that question? Do you use it? I kind of feel like it does. It makes more sense to be part of the logic related to that question versus just being familiar with it. Because then it doesn't make sense if you put it with what you're familiar with.
I agree.
Okay.
Yeah, and I was going to add, and maybe would this be a helpful question if because of our end goal is we would like to get their input on resources that would go on a like best list, right? Kind of like, the best book list. So would we want to ask a question like, would you recommend this to a peer? I mean, so they're familiar with it, they use it, we're asking how often. I was just wondering, I don't know if that question is helpful or not, but I was just like thinking, would you say this is your number 1 use? Like, what is your go-to? But I guess for question number 3, we would find out how often they use it. So then we could pull that information and determine that. Like I'm trying to determine like which one is most popular.
So could we rephrase and just have one question that says, based on how easy it is to use, how useful and how frequently you use it, how do you rate this? And then give them a continuum of that so that they're ultimately ranking their favorite that way. And so like 1 would be a low ranking and 4 would be a higher ranking.
Mhm. Or maybe we just stick with number 3. And then is there another spot in the survey that that they can star, like what's their top user? But then again, I think we're going to get that information.
I like
It's-
the idea of the ranking system, but I'm wondering like how chaotic it might be like on the back end, like once we get that data.
My thing about only asking them how frequently they use it is some of those resources, the more you use it, the less you're actually going to have to pull it out to use it. You've just ingrained some of that knowledge so that, I mean, you're still using it. You just don't recognize that you are. And so I think by limiting it to saying how frequently do you use it, or I think that's hard for them to, like I said, the more you use it, the less you're actually going to pull it out to use it.
I think some of the things like the reports are like, you're not gonna pull them out every day, but they're important to look at when they come out. So that might get not as assessed as valuable of a resource, even though they might say it is.
But then if they pulled out those reports, as it comes out, and they use that to make the basis of other things that they do now every day, they're using that really every day as the reason that they are doing the things that they're doing now. So like you said, especially with reports and things, those wouldn't be something they look at every day. And so they may not get a high of a ranking, when really that's what they're basing their policies, procedures, and activities from.
So does there need to be like a qualitative question about like how valuable do you see this resource being on some sort of scale? Maybe instead of useful. I don't know.
I don't know. That's why I kind of thought if we helped them to describe what useful is, either through how easy it is, how frequently it is, then that might give us, I don't know. I know I completely muddied the waters there. Sorry.
That's what we're good at doing at health departments, muddying waters, so.
I have a question that's not related to this specific area we're discussing, but I think when Lori brought that up, it triggered something in my mind. So the resource list that we have that they check if they're familiar or they're utilizing it, are we breaking that down by different areas? Like what we discussed before? I know I missed the last meeting. But like, do you use this for policy? Do you use this for lesson plans? Do you use this for? Is that needed? Would it be helpful to the person that's taking the survey? Does it matter? I guess it's really more of a formatting issue or a formatting question.
We can do that. I could add, like, if they select it, you could open a question with a blank text box, or we could put, how do you use this resource, and provide some examples like you just suggested, if you want.
Because isn't that how we're going to lay that out when it goes onto the page? Did we discuss that? Did we change our minds?
We discussed it. I don't know if there was like full consensus or how we were going to do it.
Okay. Sorry, I'm getting the cart before the horse.
It's okay. I mean,
But I
getting
think that is
feedback-
important. I think that is important to know, because I don't want to waste, it's not a complete waste of time, but take the time to ask these questions and then realize that the way we wanted to really lay it out, we didn't ask the questions in the way to get that information. So I think it is important to know how we want to get that, so that we can try to get the questions that are really going to answer those.
Mhm. And that we like the second format of questioning. Yeah. I mean, I think we did decide that. I think we all kind of agreed in consensus that we don't need to know how useful it is or how easy. I mean, we could use the question, how do you use this resource in your setting? Is it for activities, lesson planning, policy, rules? We could like come up with 4 categories or something. Family engagement.
Yeah, I think giving them like a list to choose from will probably be easier than them entering in their own response.
I can always put like an other box at the bottom of the text box if they think of something we don't put in the list.
And so are you imagining that would also be something they could choose more than one answer, so that they're not limited to only
Great point.
one?
I mean, if we relate it back to the knapsack tool as well, I mean, there you're using best practices, policy development, lesson planning, family engagement. I think if we would just kind of review that again and think about how knapsack measures those things, I think it's probably maybe 4 or 5 areas, and maybe put those, because then that relates back to knapsack, which is a universal tool that we're really trying to promote.
Love that.
Mhm.
Anybody off the top of their head that uses it all the time? I know it's policy, best practices, family engagement. Is there any? Or what did we put on that Excel document? I think those are policy, best practices. And maybe, yeah, I guess curriculum.
Is professional development. I think that
Yes, it is. You're right.
One.
Training. Yes. Mm-hmm. Ooh, that's a good one. So maybe there's 5. Yeah, I think that would really get us a lot of information, just like how they're utilizing it. Wow, I think that could really tell a story. Good discussion, you guys.
Okay, best practices policy, lesson planning, family engagement, professional development. Are those the 5? Okay.
Yeah.
Okay, so like summary wise, we're gonna nix question 1 and 4. Put this question about how do you use this resource? Do we want to alter like 2 or 3 somehow or keep them? Oh wait, no, you said access. Nope, scratch 2.
I think we just want to keep 3, right?
Okay.
And then add the one about what area in your setting do you utilize for this resource? Am I right, guys? So we'll just have the 2 questions. How often do you use it?
Yes.
And then,
Yes.
These down here were just additional questions we had in the survey based on last meeting and some suggestions. We can talk about if these are necessary or have repeated information.
If we think the question about more provider resources is important, maybe we could have a couple of logic questions that pop up under that. So, let me think. I had a thought. But I'm not very clear with it. Let me rethink this for.
The only one I had is this one, and it's similar to this next question about what type of resources for families and what type of provider resources.
So I could see us go ahead and go in line with the questions we were gonna, or the areas up above, and have them, so they say, yes, there needs to be more, and then it could be in those areas of professional development, family engagement, curriculum, and just keep with that consistent trend. So, and then it could also have other with those things in parentheses, if that's outside of what those 5 areas is.
So just change what's in the parentheses to those 5 areas.
Or even have radio buttons again where they would push it. I think,
Okay.
and I could
Yeah.
be wrong, but I thought when it comes to research and stuff, it's better to have less text for them to write it in, because then it's less
Yeah.
consistent.
I don't know if those 5 areas of focus would apply to family documents.
For the one that says what type of resources Oh, never mind. You're good. That second question here, what type of resources do you wish you had more of? I think toolkits. Never mind. I think that covers what I was thinking.
For the, what type of resources to share with families do you wish you had more of? In there, can we add something about like newsletter articles? Because that's what I'm always trying to tell my providers, at least, is like, hey, this would be a really good resource to add to your newsletter that you send to all of your parents. I feel like I have to spell that out for them a lot to try and get them to send out that information.
So like, I don't know how to, like, resources for newsletters. It's just,
Something like that. I don't know if we would want to add that, but that's just what I was thinking.
like, are things like reports and guidelines what they would be putting in those newsletters? Or are they more like activities or articles or research?
I think it really depends on your audience or your families. Like, I
just
could
know
see-
some of, oh, go ahead.
No, you go ahead.
I was just thinking like my providers, I send reports to them and they barely open that email. Like I get maybe 2 or 3. And I think like just changing that word to like articles might be a little better.
Yep. I like that. Yep, I like that too. Yeah, Lori, you're thinking right on. Yep, that's exactly what our plan is.
Oh, is that it? Okay, because I haven't been in on the whole front end of this, so I've been just sitting here listening and
Good. Yeah, that's great. I'm glad that you came up with that idea too. Yep, I like that. I could be really getting into the weeds, but even, I mean, changing reports to articles, but even books. I don't know. Like I say, I could really open up a Pandora box. So sometimes you just have to shut me off because the list could get so long.
And I think that's it. The list could get so long, and so et cetera, just that
Yes,
gives them
That
the
covers it.
opportunity for anything else that they think they want. Put it.
I agree. Yep. That's good.
Okay.
The question that you have, would providing access to current high quality early childhood physical activity resources be useful to you as a provider? I was wondering if we could rewrite that.
I always wonder if we even need that question.
Does that open into a text box afterwards if they say yes?
No. Don't follow.
No follow-up.
I was just
I was gonna
thinking
say,
if-
if we did follow up to it, then, or you could even just ask it from the beginning, tell me how. Instead of would give them an opportunity to tell us more about how they could use it. Tell me how.
I was wondering for that question and the one below it, because if
Mhm.
our end activity is that this list would go, would reflect the best practices across our 6-county area. Anyone would have access to it, right? It's not like you get a special code, right? It's not like a club. I'm just sorry, I'm just thinking, because that question to me reads weird.
Yeah.
I get what the intent behind it is.
Yeah.
Would you use, I'm just trying to think. Would a best practice list or would I don't know.
Or just asking a yes or no question if it's difficult to find high quality resources.
Or is the intent on asking them if we had a resource, would they use it? Is that what the intent was?
Yeah.
Well, and the other piece is if we put it all on the KCPA plan website, is that a convenient location for them to go to
Yes.
remember to go to access all of these links versus trying to remember the URL or, do the
Yes.
Google search or that sort of thing. So I'm not sure would access to high quality early childhood physical activities be useful because one might assume that by clicking on any of the resources above, they already have access to them. But
Mhm.
the question about would having these on a single website be useful would tell us whether or not it's going to be valuable for us to go to the
Yes.
effort to put all these resources on the KCP plan website.
Yep. And maybe scratch the question that you have highlighted in mint.
Yeah.
Yep, I agree. I think that one's getting what we need. Just reads a little bit clearer. Nice job. Thank you, Natalie, for putting this all together.
Yeah, and this was a really time-consuming thing. You can see how many options and questions there are and what Natalie put in for consideration. So
Yes.
typing all of this into the REDCap tool is really no joke.
Yeah.
So thanks, Natalie.
Yes.
Great
Thank you
job.
very much. And thank you for providing options too. Just different formats, and that's great.
Yeah. I don't think it'll be too bad now that it's just 2 questions I need to go in and add for this. But when we had a list from our last meeting of like 8 questions for every resource, I was like, that was going to take me forever.
Those high achievers. Awesome. It's exciting. So our plan, which kind of piggybacks off of Lori's comment. So for those of you that haven't been on the meetings for a while, gosh, I'm going to say 3 years. I know we have the date somewhere, Shelley, but we did engage with, I think it was a group of about 8 providers, and they were across all different types of settings. So we had home providers, some were in Wyandotte County, some were in Jackson, as long as some were in Johnson. They represented the 6-county area that we're focusing on. And we did engage with them over 3 different sessions. We were thinking for sure to re-engage back with them. And then I believe our other plan was that we would then utilize our partnerships with those that are on the meeting for sending that out. So through the Family Conservancy, through Lori at the UG, being able to send out to those providers to get the health department, all of them to be able to reach out to providers across the 6 county area. Is that still our plan?
Sounds like a good one to me.
Maybe that's a good, does anybody have any other questions around the survey, the purpose, how we're going to send it out? When are we going to send it out?
As far as like the end, I got thinking maybe I don't want to put a time frame on the book or set arriving. But I wanted to, I don't know if I should give them some information about when to expect their incentive.
I think we could say something like, if you've selected to receive Dr. Kraft's materials, expect to see them within 6 to 8 weeks. And then
Okay.
if we beat that, we're awesome. But this, I mean, the coordination of that may take a bit of time. And then again, that piece still has to be approved. The funding piece to cover that still has to be approved by the core work group for the KCPA plan.
And do we have any type of incentive separate than that we're gonna have for the
Other
group
people.
that are gonna review this first before we send it out?
We don't. So, I mean, just to quickly answer your question, we don't yet. That doesn't mean we can't do it. We just hadn't thought all the way through that, honestly. The only thing I will say is it's easier for us to provide something tangible versus a gift card. Gift cards have to go through a whole separate process, and then you have to give us some information about yourself to be able to get it. If we're shipping you something that's like Dr. Kraft's materials, it seems to be a bit easier. So open to ideas. So thanks for the suggestion, Lori. Open to any ideas.
This is more of a logistical question and maybe a suggestion. I have ordered from Dr. Kraft before, but I only shipped it to my home address. Is that our plan, that it would go to Children's Mercy and then you would run it through the mailroom?
That is sort of what we were thinking initially. I don't know what that adds to our costs, because we'd be paying for shipping twice. Basically, you know, shipping from Dr. Kraft to us and then shipping out from us to whomever. So we'll have to do some digging on that to figure out what our options are. I wonder if we bought a bulk, bought her resources in bulk, if we might be able to get some sort of discount that would help equal, I guess, mitigate those costs.
Yeah, what are we anticipating the return rate on this survey? How many providers do we think we are going to get to fill this out?
And that's a great question. I don't have any idea. I would love to see 20 responses. I don't know if that's realistic, because we still have to come up with a list of all the providers to send it out to. And honestly, we don't necessarily need that list. You all as partners have better lists than we do. And so we would probably lean on you all to just send it in your, through your channels, and then we'd basically see what we can get. So I'm cautiously optimistic and suggesting that maybe it gets out to 100 providers and then we get 20 responses. But that's, I mean, that's a kind of a pie in the sky
That's good, because I was gonna go with 50, because I was looking across our 6 counties,
Yeah.
and I was hoping that we could at least get 50
People to respond or 50 to send it to?
to respond.
Oh, that, I mean, if we got that, holy smokes.
I mean, I don't know, I'm just thinking of all our great partners here.
Yeah. So I think, 20% response rate is really pretty good for something like this. If we could get a higher response rate, then,
Yeah.
wow, even better. That increases our budget, but
Yeah.
that's the next piece to this really, is looking at what's the implementation project request related to this work, and what do we want to anticipate? So for example, in the application, we would say something like, we anticipate 50 providers respond to this survey, meaning we're going to send 50 resources out. What's the maximum cost? So we'd put that in, and then we'd say we would only use, if only 20 people responded, we'd only use that amount of money. So we're not just going to sit on the extra money in the sector work group. We turn it back to the sector for other implementation projects as we move through this. But we want to hold
Great
a certain
point.
amount of money until this survey is done and we've set the end date and we're moving forward with the analysis.
Yep. Great idea. Natalie, do you want to this kind of segue, since we're at 10:10? Do you have like just a rough outline of the implementation project
Yeah.
to bring up to the group?
To-
So we're going to switch gears now, and we are going to talk a little bit about and asking for your feedback for the implementation project to be able to purchase the Dr. Kraft books for those that completed the survey that we just reviewed. So we'd like your input so that it can go in front of the core working group to be reviewed.
This total cost, we might have to adjust based on how many providers we think will fill out the survey. That was just a number thrown out when we were making this earlier in the year.
Do we want to be consistent with, instead of early childcare providers, that the early care and education professionals? Thank you.
Been here a few times. We probably need some work on aligning it with our strategies and tactics. Is that helpful if I pull up the strategies and tactics?
Yes.
What are the strategies you put on the on the application? Six and seven. Thanks, Chelsea. I think 6 and 7 makes sense.
Okay, I don't.
And I think for 7, tactic 2, which is collaborate across collaborate across sectors to ensure families have connections to resources and strategies for physical activity. I do think there is some of that that's happening here. So I can't remember who alluded to it when we were talking about the survey, but we're rewording one of the questions to be more broad about physical activity resources more broadly. And so I think we're not just looking in early care and education information for this, for resources. We're going to be looking to, let's say, the National Physical Activity Plan or the Physical Activity Guidelines or other resources beyond just what's available for early care and education providers. So I think that kind of aligns with what we're doing here. So yeah, strategy 7, tactic 2.
And I would suggest that strategy 6, tactic 2 needs to be cut because we're not collaborating. Not that we're not collaborating, but we're not promoting through this activity. We're not promoting Knapsack, Missouri Move Smart. I don't think directly we are.
Right.
So I would cut that one out.
We could keep 1 in though, because
Yes.
yeah,
Mm-hmm.
because we are compiling and disseminating documents.
Yep.
But I think that's the only tactic of strategy 6. And then, and
Mhm.
again, it's fine. I think if we align with 2 strategies and 2 tactic and a tactic under each of those strategies, that's good alignment.
Mm-hmm.
Well, especially because then it can be further used to do the promotion and those things later. But this specific project is to get this piece so that we can grow the next project for something more.
Well,
Yep.
right. And
It's not the end.
that's important to include in the very last piece of this document. Like, what are the next steps? Okay, so we're already aligning with 2 strategies, and our next steps is once we have this list of resources, we're going to begin promoting it across sectors and put it on the website for ongoing use, and then connect back to our work with Go Knapsack, the Go
Correct.
Knapsack report.
Yep. And I also want to point out that in that first tactic of strategy 6, we said that we were going to do recommendations by age group. And we have not done that yet. So we're compiling and disseminating these resources, but I think we were also, maybe this is a different, or this could be what's next, but this was the priority best practices that we talked about. Which we have, I don't know, I'm just sitting here looking at that one now and I'm like, we didn't really identify. I mean, I guess that's the next steps, is if we look at the feedback from the survey, then we can identify the resources that are being used the most. Then we can make the recommendations and disseminate best practices that we would have in our regional area. But we haven't done that yet. That would be like a next step if we wanted to include that.
Okay. That really good information to put down here.
And Rhonda, that may be something we want to include in the survey. So there's one, and I'd have to go back to the survey and look and see what are the questions we're asking. But there's one that we're asking about, are we missing anything? And it might be that we ask about certain age groups.
Yeah.
So we know we're only talking about birth to 5 for these providers, but and you all have more experience with this than I do, but is there a gap? Like, are there really good resources from 2 to 5, but there's not from birth to 2?
Yes.
And the only one I can think of off the top of my head in the list that we have that might include anything from, there's only like 1 or 2 that might include something from birth to 2. And
Yep.
so that we might want to think about that
Agree.
and include that in the question about what resources might be missing. Because that would help us go back and align with our strategies and help us come up with our next steps for this, for the early childhood sector.
Yep. Great suggestion.
Yeah. What was your suggestion? Great point.
Maybe in where you're at, where your cursor is at, Natalie, recommend resources, recommend maybe identify best practice, identify best practices by age group.
Best practices and resources by age group.
Mm-hmm. What's the best, is the best distribution model, is that referring to paper, electronic, on a website?
Yes.
Yeah.
Well, and
how
I
getting
would
that
I would
information?
probably be a little bit more specific with that because we're specifically interested with the website.
Yeah,
Determine if putting this resource list on the KCP plan website is useful for these providers.
right,
Because the reality is, what if they think it'd be more useful on the Family Conservancy website
right.
or someone else's, Child Care Aware of
Mhm.
either state? I don't know. I mean, I think that's what we're trying to get at. We're not trying to force our website down people's throat. We're trying to find out, where do you go?
Yeah,
What's useful?
yep.
So do we need to add a question? I know the question asked if it would be good for all of these resources to live in one single website, but we didn't ask as to what,
Where?
yes.
Yeah, really good
Yeah.
suggestion.
Yeah, I think you're right. And I think we should say things like Family Conservancy, Child Care Aware.
Yep,
And
health
I don't,
department.
for those of you with Child Care Aware, do we need to specify Kansas or Missouri, or can we just say Child Care Aware? And then we can put the KCP plan website, we can put other, and then they can type in an other spot if they think it's helpful. Like Mark is with their Head Start work, is that where, is that a useful, I don't know, but.
Yeah, great addition. I think we just noticed a little typo, too many N's in Diane's name. Right there. Thank you. And in that paragraph below that, just changing provider to professionals, just keeping that language.
Yeah.
And remind me, who's going to be able to, again, we don't, like you said, Shelley, we don't need the list of providers, but was Child Care Aware pulling those? I don't remember where we left off. Or who we're asking to disseminate this.
Right. Yeah, I talked to
through?
Chris about it, and we cannot do like targeted county email blasts anymore. So we would be Chrissy and I, who's been on previous meetings, pulling from our caseload
Okay.
to begin with. And then we could figure out going forward, how to get that spread to the
Excellent.
masses. Yeah.
Thanks, Maddie. Maybe in that paragraph too, if you could add where you have promoting programs like Go, Knapsack, and Move Smart, just because it's local. Awesome.
This one I put, but we haven't discussed if we're gonna follow up or how we're gonna follow up, so maybe I should take that out or check if it's being used.
Yeah, that's kind of a lofty goal.
Yeah. I mean, well, if it was our website, we could look at like click rates, I guess, but that would be the only thing I can think of off the top of my head. But if we're not gonna house it on our website, then that would be more difficult to collect data on.
But if they
Our
are
partners,
supplying,
right?
well, I was just gonna say, if the surveys themselves, that's gonna be the people who are filling out the survey. So we'll have their contact information to send out something, even if it's just a little checkup email. Hey, how's it going? So we could do that based on the
True.
information we'll have through the survey.
I think, Natalie, what were you thinking with this too? Because that's a good point Lori made, that we do have those emails. We will have those. Are you thinking more of the follow-up? So here we identified the list of resources based on their feedback. We put it on, I'm just going to say, the Family Conservancy. I mean, with their partnership, I mean, they could track the traffic. So, I mean, I think that could be achieved.
I don't think you can achieve finding out if they're using the actual resources
Yeah.
without talking to the provider or the professionals themselves. You can track if they are looking at the resources, but not if they're using them.
Correct. Yeah. Good point. If is being, I mean, yeah, if you wanted to see if the resource website is being used, yep. Yeah.
Are we also gonna follow up with providers in some way?
Yeah, I think we could, what if 90 days after it is identified where it's going to be? I mean, obviously we would need to share that out where it's landed. And then maybe 90 days following that to see how many times they've gone to that list.
I have a random question that might relate to this, but for those of you who work with ECE providers, is there a time of year they're more likely to access these resources, or is it going to be all year long? And the reason I ask that is because from an analysis standpoint, so if we're trying to look at click rates, if we look at the wrong time period, if we don't look over the course of a year, are we getting the information that we want, or are we getting an inaccurate picture of utilization? And I'm thinking, you know, like, is it like school? And so I know new kids are going to be coming in on a regular basis. Like, I do understand that, but do the changes occur more frequently in, you know, June or August, because that's when kids might be leaving and spaces would open up? I don't know. Are there times of the year that people might be more likely to do family engagement activities, so they look for resources? Anyway, I don't need to belabor the question.
Yeah, I think providers are always kind of searching, but the times would be, you know, going into summer when they may be taking on school age children that they didn't have during the school year full time. So a lot of them do struggle finding a balance between, okay, how do I get my toddlers outside and playing? How do I get, you know, the 10-year-old outside and playing as well? But then also winter, indoor play and physical activity is huge. I get a million questions from providers about like, what can we do? I think the whole like cabin fever thing, they really just need, you know, to figure out something to get the little one's energy out. So I think both, you know, going into summer and then winter, kind of midwinter as well. And for family engagement, I would say going into the school year.
I think that's a really good question, Shelley, but I think it's really hard to answer because I think of corporate childcare companies, I think of Head Start, I think of, you know, a small family childcare provider, and I think they're all going to be doing different things. I mean, there are some childcare centers that plan their whole year out in the summer, and there's others that do lesson plans every week. So it really varies.
Well, so I think we could probably leave that last statement very vague and broad, like following up to see if the resources website, however we word it, but to see if people are utilizing the resources from the website. So we don't have to say the time frame necessarily on this application, but I think we could keep that in mind as we think about it. Maybe we analyze it quarterly, but we do it over the course of a year so we get more information.
And I would also add there too, like where we say we'll follow up, I would like to see how.
Oh,
Because what does that mean? A phone call? Does that mean a letter? Does it mean? I think
Yeah.
the core working group would like to see the how.
Yeah. And I do think looking at click rates is probably reasonable to start with, at
Yep.
least for the purposes of this.
Yep. I also want to be aware that it is 10:32.
oh, yeah.
Time flies fast when you're having fun. A lot of good information, a lot of good work that we got done today.
Yeah, thanks everyone.
Before
our
we
next-
close, is there anything else, Natalie, on there?
Just our next meeting is going to be June 22nd at 9 a.m.
Okay.
I'll
Thank
send
you for
out a
that
reminder with a
reminder.
link. Yeah.
And is there anything that anybody wanted to share from their organization before we close? Because I did not include that in the beginning. All
I'm
right,
just
well,
excited. I was just gonna give a shout out to Lori with K-State Research and Extension. She's going to be doing a training for our Wyandotte County providers, Healthy Body, Healthy Brain. So that will be June 8th. And she doesn't even know this yet. We already have 33 signed up. So it
Ah,
just went out
Hmm.
yesterday, the day before, something like that. So
yay. Good to know. Thanks for that update.
that's awesome. We look forward to hearing about it. Great. Any other updates before we jump off? Well, thank you, everybody. This is a really productive meeting. We couldn't have done it without each and every one of you. So thank you so much.
Yeah,
We'll see you next month and have a great holiday weekend.
same.
You, bye.
Bye.